Yeah, I know. And we this is the fate of those that come late. That those who took the time prior to them caused them to take less. So please stick to like 10 minutes if you can. Thank you.
May I request the speakers to maintain the timelines? Yeah.
Good morning, everyone. I am Dr. Harsha Jayakody. I am from Sri Lanka. So I'll be talking about how AI for health in Sri Lankan country perspective. I'm a medical doctor with 12 years of experience, clinical experience in the medical field. Out of this 12 years of experience, I have worked in many areas, subspecialties in government as well as private hospitals. And I am the founder of mydoctor.lk, which is a digital health care platform which connects doctors and other stakeholders like pharmacies, labs, and with the consumers. So I founded it in 2012 as eDoctor. Then I actually got some funding, and then with the Dialog Asiata PLC investing, I changed my brand name to mydoctor.lk. And so today we are the pioneers in Sri Lanka. So just to give the Sri Lankan perspective, in Sri Lanka we have government public funded as well as private funded health sector. So mainly our majority is the public funding, because it's free of charge for all the citizens in Sri Lanka. So if we get outpatient department, we see around 48 million of outpatient visits happen per year, which is around 65% of whole segment. And in the private sector, it's around 33%, which is 24 million outpatient visits happening. And when we take the inpatient visits, we see it as 95% of inpatient visits have happened in government hospitals, and only 5% happen in the private sector. So why I want to tell this is the actual problem in Sri Lanka. So because of this free health, all the government sector hospitals, state sector hospitals, and other state sector medical clinics are overcrowded. So sometimes the care may be reduced because of a lot of waiting time, then unable to reach certain specialties. And also in Sri Lanka, the specialties are not all over the country, spread all over the country. So it's mainly the Western province, which Colombo is there, and the other rural areas, they don't have proper facilities. So that is the main problem. So in Sri Lanka, we had few milestones, just to tell you. So in 2015, we started this digitalization of health records in government as well as private hospitals. So it was the first digitalization happened before this, but as a policy, government policy in 2015, this digitalization happened in the health records. And then telemedicine platforms were introduced even in government sector in 2016. And towards the 2018, the big data analysis was done, initiated in most of the areas. And in 2019, actually, the prediction modes were initiated, like teleradiology, teleophthalmology, where predictions with the aid of the data, as well as giving decision support, like through teleophthalmology and also teleradiology, where consultants can give their inputs. And in 2020 and above, we are looking for this AI through these cognitive applications, as well as proper predictions. So if you get around what are the world, just to give you a brief idea. So for diagnosis, and then chatbots and surgical robots. So those are, and there are certain opportunities in Sri Lanka, so which we have identified. So I'll quickly go through that. So as I told you, due to higher waiting time in Sri Lanka, especially in the public sector, we have identified that if we have certain chatbots or virtual assistants through AI, we can actually reduce the waiting time in a lot of these hospitals. And also the shortage of medical services, which I told, it's not spread all over the country. So with the aid of AI, we can actually predict what are the services needed, what are the human resource power needed in these other areas also. And also with the aging population increasing, especially in Sri Lanka, we can use AI for this reducing the NCD of this aging population. And also when it comes to mental health, so we have started doing a few researches where we can detect people's what they choose in a sentence or what they use in languages, so and predict the people who will go into depression or who have certain stress. So we can reduce the number of people who will occur mental illnesses in the future. And also for counseling also, this AI based systems can be used because people feel more comfortable and also to have regular care. So I have identified, we have a few challenges. So like low data quality and less data quantity in most of these systems. So we have to address that. And then people have wrong perception in Sri Lanka about their job security. So we have to educate people on how AI will increase the jobs and how opportunities they will get, what are the benefits. And also we have a lack of trained staff and lack of understanding among technical staff. So that also we have to train them. And also the in private sector, we have seen lack of business alignment with the AI. So some people think that AI is not, it's a futuristic, but always we have to be futuristic when it comes to healthcare. So that is what I just want to tell you. And just to give you in prehistoric Sri Lanka also, there were there was King Ravana in Sri Lanka, which in ancient things they tell that there was this Pushpaka Vimana where AI was used as machine learning. Thank you very much. Thank you for inviting me.
Thank you very much for very